Hashimoto's thyroiditis is an autoimmune disorder in which your immune system attacks your thyroid. It is the most common cause of underactive thyroid or hypothyroidism in the United States. To help you better understand this medical condition, I will first describe the function of the thyroid and how the production of thyroid hormones is regulated in the human body. The thyroid is a small butterfly-shaped gland at the base of your neck and below your Adam's apple. The thyroid, which is part of your endocrine system, makes two hormones, thyroxine, also called T4, and triiodothyronine, or T3. They are carried to the cells and tissues all over your body through blood circulation. The T4 has only minimum biological activity. The T4 is converted into the biologically active T3 in your liver and other tissues. The T3 controls your metabolic rate and coordinates the activities and functions of all the cells and tissues in your body. The production of thyroid hormones by the thyroid is regulated by pituitary gland and hypothalamus, which is a part of the brain. They increase or decrease the stimulation on the thyroid depending on the levels of thyroid hormones in the circulation. For example, if your thyroid hormone levels are below the normal range, the secretion of thyroid-stimulating hormone, or TSH, from pituitary gland will increase. The TSH will prompt your thyroid to produce more thyroid hormones. We do not know exactly what triggers your immune system to attack your thyroid gland. We do know several risk factors for the development of Hashimoto's thyroiditis. The risk factors include females in their middle age. Although Hashimoto's thyroiditis can occur in men and women at any age, it primarily affects middle-aged women. It is 4 to 10 times more common in women than in men. Heredity. You are at higher risk for Hashimoto's thyroiditis if thyroid or other autoimmune diseases occur in your family. Other autoimmune diseases. If you have another autoimmune disease, such as rheumatoid arthritis, type 1 diabetes, or lupus, you are at higher risk of developing Hashimoto's thyroiditis. Previous radiation exposure also increases your risk of developing Hashimoto's thyroiditis. Studies have found infiltration of T cells and B cells in the thyroid of patients with Hashimoto's thyroiditis. It was believed that cytotoxic T lymphocytes play an important role in the destruction of thyroid gland. Autoantibodies may also be involved in the death of thyroid cells. Many people with Hashimoto's thyroiditis have no symptoms in the early stage. Some people may have a painless, firm enlargement of the thyroid gland or have a feeling of fullness in the neck. Rarely, people with Hashimoto's thyroiditis can have an overactive thyroid or hyperthyroidism, which causes heart palpitation, anxiety, sweating, and heat intolerance. As Hashimoto's thyroiditis progresses with more thyroid damage, you may have one or more of the symptoms of hypothyroidism. Signs and symptoms are illustrated in this cartoon. Hair loss, increased sensitivity to cold, a puffy face, goiter or enlarged thyroid, enlargement of the tongue, fatigue and sluggishness, depressed mood, memory loss, etc. Untreated hypothyroidism can lead to an enlarged heart and possibly heart failure. Females can have excessive and prolonged menstrual bleeding. Hypothyroidism can cause decreased sexual desire in both men and women. It can also cause infertility. When women with uncontrolled hypothyroidism do get pregnant, their children can suffer from lower IQ and impaired mental and motor development. Rarely, patients with chronic, severe, and uncontrolled hypothyroidism can develop myxedema. It is a rare but life-threatening condition and requires emergency medical treatment. The diagnosis of Hashimoto's thyroiditis is based on your clinical signs and symptoms such as an enlarged thyroid, fatigue, etc., and positive antibodies against thyroid peroxidase. If your thyroid is underactive, your blood tests will show low levels of T4 and T3 and elevated level of TSH because your pituitary gland secretes more TSH to stimulate your thyroid gland to produce more thyroid hormones. Thanks to the availability of sensitive TSH tests, thyroid disorders can now be diagnosed much earlier, often before you experience any symptoms. Occasionally, thyroid ultrasound is needed to rule out other thyroid conditions. It is worth to note that not everyone with Hashimoto's thyroiditis has a positive antibody against thyroid peroxidase. Many people with a positive antibody against thyroid peroxidase do not have a goiter, hypothyroidism, or other thyroid problems. The treatment for Hashimoto's thyroiditis include observation and oral thyroid medications. Your doctor will monitor your disease progression if your thyroid hormone levels are normal. Avoid iodine supplements or eating foods such as kelp, dulse, or other kinds of seaweed which contain large amount of iodine. Excessive iodine intake may cause hypothyroidism or make it worse. Oral synthetic levothyroxine is the standard treatment for hypothyroidism. Synthetic levothyroxine is identical to thyroxine or T4 produced by your thyroid gland. Levothyroxine is converted to the biologically active T3 in your body. The oral levothyroxine can normalize hormone levels and resolve the symptoms of hypothyroidism in most patients. Some patients may continue to have unresolved symptoms of hypothyroidism while on levothyroxine. Some of these patients may need to take a small amount of liocyanine for symptom relief, although most clinical studies fail to demonstrate the advantage of this method of treatment. Older people, people with cardiovascular disease or severe hypothyroidism may need to start with a lower dose of levothyroxine, and the dosage will be increased gradually to allow your body to adjust to the increase in metabolism. Although the standard treatment for hypothyroidism is levothyroxine, Armour Thyroid is also available. It is the extract from the thyroid glands of pigs, which contains both T4 and T3. People should be aware that the ratio of T4 to T3 in pigs is not the same as in humans. In addition, the amount of T4 and T3 in each batch of Armour Thyroid may not be consistent. Pregnant women with hypothyroidism require an increase of the dose of levothyroxine by about 30% to meet the higher demand for thyroid hormone during pregnancy. If you are on thyroid medication treatment, your doctor will check your TSH level periodically to make sure you are on the right dosage of thyroid medication. Overtreatment with thyroid hormone can accelerate bone loss, leading to osteoporosis or make osteoporosis worse. Levothyroxine overdose can also cause arrhythmias. Certain medications, supplements, and foods may decrease the absorption of levothyroxine. Here are some examples. Please be aware that aluminum hydroxide, magnesium hydroxide, calcium carbonate, and simethicone are the common ingredients in some over-the-counter antacids. Taking levothyroxine 4 hours before or after these foods and medications can minimize the problem of decreased absorption. With that, I will conclude today's video. Thank you for watching.